Welcome back. Now, poverty increases mental health challenges by contributing to factors such as unemployment, food insecurity, and limited access to healthcare and education. Now, these conditions can lead to increased levels of stress, anxiety, and depression, further elevating the risk of suicidal behavior. Joining us today is Dr. Armas Shikongo, a counselling psychologist, to shed more light on the matter. Doctor, good morning. Thank you so much for making time to speak to us.
Yeah, it's always a pleasure to be here.
Okay. Now, some might be thinking, how does being deprived of things, affect people, or definitely perhaps maybe affect someone's mental being?
Well, first of all, the main reasons why, as human beings, we would like to live more in life is because there's something that is basically giving us a reason to exist and to continue and survive. So that is a natural instinct. It's a natural condition of human being. And that's sometimes also what we call the meaning of life or the purpose of life. And the moment that is lost, a human being start questioning, why do I need to still be on this planet and stuff like that. So, and now imagine if you're in a situation where you see other people that seems to be enjoying life and you don't have anything. Naturally, it will bring a lot of negative thinking and sort of reasoning, and that, of course, sometimes results in negative behavior. So naturally, one would say that if one is deprived of the means of existence, whether it's food, whether it's shelter, whether it's the means to afford health or education, definitely it can result in a situation where a person starts feeling not only anxious and fearful of the future, but obviously also thinking negatively. And that's why sometimes we have situations like, as we were saying, depression, suicide ideation, and unfortunately in some cases, people even take their own lives. Because when somebody doesn't have hope, they start also feeling very useless also. And when a human being loses that sense of being worthy to exist, they really become self-harm. They start harming themselves in so many other ways. Yeah, and that can manifest in so many different ways for sure, yes.
Now, Doctor, is it perhaps correct to say that those, the absence or poverty of these things that one is deprived of affects obviously people's mental well-being differently? Is there a difference between those that are living in rural areas and those that are in urban areas?
Well, as human beings, we are obviously not monolithic. We don't necessarily think the same. We don't react the same to things because there's a subjective element to life, meaning that how you look at things, it will be different from how I look at something. We may be in the same condition in terms of material or environmental sort of circumstances, but the way we interpret, the way we look at it matters, and that's actually how you find as human beings do things differently, apart from our differences in terms of personalities and other factors. So what we are also saying is that the environment can have an impact, yes, but how you respond to it is actually much more important. And then, of course, that may then may even be immaterial whether you are actually in the rural area or in the urban area. The only thing is that generally in the urban areas, the situation is sometimes a bit more difficult in the sense that sometimes you, especially if you are exposed to so much material sort of abundance around you, but you yourself, you are not able to access it. It makes you feel much more alone in that space. But generally in the rural areas, people, they tend to have a more solidarity type of lifestyle. They tend to share more. And even the level of social support tend to be quite high. Things are changing, obviously, because we are also affected by urbanization and modernization wherever we are. But generally, if you look at the lifestyle in the rural areas, people tend to have a sense of solidarity more compared to places in town. For example, you find that you may be staying in the same place with other people that you don't even know. They are your neighbors. But only maybe if something very dramatic happens, that's when you tend to relate and communicate.
Correct.
But in the rural areas, people tend to actually relate much more freely. and their level of interaction tends to create a sense of social support. Because one of the issues also that plays a big role in our mental well-being and mental awareness is whether we feel supported, whether we feel we belong to a particular, social group that is giving us support and stuff like that. Even when we are material deprived, because it obviously doesn't necessarily mean that if somebody is rich, they will be happy, or if somebody is poor, automatically they will be unhappy. So it's actually not exactly like that.
Not exactly like
in fact, in some cases, you may find somebody is deprived materially, but internally they are happy, they are content, they are satisfied. Especially also when you bring in also issues of spirituality and stuff like that, because in life also, as Jesus would say, that a man doesn't just live by the bread alone. So we don't necessarily exist purely because of material, things. We also, there are other things that also sustain us as human beings. Yeah.
Doctor, perhaps maybe what are the psychological impact, that it has on someone that is probably being unemployed or fearing, being unemployed, especially, for instance, maybe on young people, seeing that 70% of the population is currently youth. We know they struggle with regards to employment opportunities. And what are some of those coping strategies that especially young people should adopt, to persevere or to be resilient through these challenging times?
Well, first of all, some of these things are also bigger than individuals. Like you say that, for example, if the economy is not doing well, naturally it will affect the individuals within that society. But also, especially the youth who are generally seen as the future generations who are supposed to be leading and all that. And of course, if they don't have opportunities or they feel the opportunities are not being made accessible to them, even if they are there, then that will obviously create problems. Sometimes that's where we resort to negative coping behavior, whether it's substance abuse or whether it's just self-harm kind of behavior in terms of lifestyle. And then that's how we sort of end up sabotaging our own futures, especially as a youth. But then the environment also, if there's a support environment, that will counter that. And I think that's why you see also government, they are always trying to do all kinds of things to support the youth. Recently, there's been this youth fund that has been rolled out. And I think that's a way to also make the youth feel supported and given opportunities. And of course, through education as well, because this is how you create the environment so that an individual feel that, yes, someone out there cares for me. But also, it's also very important that the youth themselves, they take it upon themselves to make use of these opportunities, but also to be creative. Because I always say that, the mind and the brain was not specifically put in, especially if we are talking about the brain, which is very much involved in creative thinking and critical thinking. It's not there for you to sit in your skull there. It's something that you must use to solve problems, your own problems, and of course the society's problem, because that's also how you may end up getting a profession, Yesterday I had a very interesting conversation with one young man, and he was showing me his invention. He's actually into cybersecurity, and he realized that there is a need in the society. So he created an app which he wants to actually introduce and get support for it. But he actually identified a need. And now he decided, because of his computer science knowledge, he wants to bring this to the market. And that's actually how the youth also must actually think. Because most of the time we tend to look, oh, government must do this. This one didn't do this for me, as if people owe you, that kind of a thing. So yes, the society definitely has to create a conducive environment, but also you as a person, as an individual, you have to take it upon yourself to take advantage of those opportunities or to think creatively, how do I also create a good life for myself? Because when you take charge, it also energizes you. It makes you want to spend your energy into something positive.
Okay. Doctor,
yes.
Let's talk about those challenges that the poor people in Zambia face when seeking mental health care access, cost and stigma. Are there still barriers that prevent them from accessing these services? And perhaps what can the community, support systems, counselling or local NGOs can play in elevating this, mental health burden of poverty? And are there successful examples that we have used in Namibia?
Yeah, maybe this is where we can actually highlight the urban-rural sort of difference there and divide, because most of the psychological sort of professional psychological services tend to be concentrated in urban areas. Even also the professionals themselves, they tend to be also concentrated in rural areas, in urban areas. One of the main reasons is because of the purchasing power. Most of the people who are employed, people who are on medical aid, who can access some of these services, they tend to be in urban areas. So that is, I think, one element there. And then, of course, in rural areas, people tend to not even be aware of some of these services. The only thing is that, of course, these services are also offered maybe in a different way or in an informal way. Like I said, sometimes there's an element of social support. Social support is generally free. You don't even need to pay for it because, for example, if you lost a family member, people are going to come and console you, they stay with you and stuff like that. And that is very important. It's a cultural resource which is being free. But then you also find that as a society, when we develop, especially when we evolve, especially into more modernized, you find that some of these things also, they start changing. And that is why you find that then you need to have initiatives either from government, from non-governmental organizations, to also set up certain institutions, structures that can also contribute to actually providing professional psychological services. Because only when you have a professional offering a service, you will be able to actually have properly delivered services. Because it's not enough to have informal sort of environment, because in some cases, there are also other issues that have to come in. You need professionalism, you need observance of ethics, you need the observance of the law, because in some cases, when the service is free or when it's informal, it also tends to lack this other element of protecting, especially the individual who is looking for that service. And that's why sometimes we have mushrooming of people who are taking advantage of people's mental health by offering all sorts of things that are not necessarily professionally derived in terms of services and training. And then poor people, then they tend to be the victims of this type of people. Sometimes they use religion, sometimes they use tradition and culture, or even fake, sort of qualification. But if someone is educated, if someone is enlightened, they tend to know how to actually even make a distinction between somebody who's for real and somebody who's just claiming things and wanting to take advantage of people. But I'm sure that also in Namibia, we've been having a number of initiatives that have been successful. Obviously, we know about Child Line Namibia, that has been very successful in terms of giving crisis, counseling and stuff like that, trauma counseling and all that. And I'm sure also even churches especially, they've been providing some of this, especially faith-based community rather, if I can put it that way. They've also been providing some of these services, sometimes even for free as a charitable sort of service, but also as something that is done at a fee. But like I said, in rural areas, people tend to not really have direct access to some of these professional services, but they tend to either maybe depend on their family members or people that they look up to, or even some community-based sort of maybe counselors, something that I think we need to promote quite strongly. Because also there is something called community-based counseling services, where you may not necessarily find people who are trained professionally, but people who are available, who can be given basic counseling skills. And then they be able to help, while because they are based in the community. And in that way, you are also able to leverage then that resource, even if people are not necessarily trained professionally, but they can be trained by people who have professional skills and expertise. So that is also another issue that I think can then help to manage this issue of urban-rural divide.
Indeed, Dr. You have answered the last two questions that I had, but thank you so much for making time to speak to us. It's always a pleasure.
You're welcome. Thank you.